where she provides career coaching and professional development opportunities. With such a rich history of mentoring, we are very excited to have Sue with us today. And with that, I will turn it over to you, Sue, to introduce our panelists.
Thanks very much, Holly. I'm really happy to and excited actually to do this. I was pleased when APHA asked me to moderate. I'm getting to work with, in alphabetical order, I'll introduce our panel, but it's great because Emily Bartlett, RN, MS, and MPH, and I met each other a couple of years ago when she was very active in the student assembly. She's since graduated, is a pediatric registered nurse at New Alternatives for Children, and she's a current doctor of nursing practice and family nurse practitioner, primary care student at Columbia. Congratulations for joining nursing. Our second panelist in alphabetical order is Monica Mitra, PhD, MA, MSc. She's the Nancy Lurie Marks Associate Professor of Disability Policy and Director of the Lurie Institute for Disability Policy at Brandeis University's Heller School for Social Policy and Management. Lavon Ortega, MD, MPH, is the Program Director for CDC's Academic Partnerships to Improve Health within the Division of Scientific Education and Professional Development at the Centers for Disease Control and Prevention. And Max Severide, MPH, is the Emergency Medical Services Specialist at the National Highway Traffic Safety Administration Office of Emergency Medical Services. So welcome to all of our panelists. We're going to divide the time of the panel into two sections. The first will be the mentoring backgrounds and also benefits and challenges. And the second big area will be on mentoring relationships and the actual mentoring process itself. And we'll leave you with specific actionable resources and best practices before we open up for questions. For each of the panelists will respond generally to these. We're planning to give you bite-sized chunks of information, so there's plenty of time for you to discuss later. So first, we're going to start with each person's background, which includes how do they get their start in mentoring and how it's affected their career trajectory. So I'd like to ask Monica to start first, please.
Hi, Sue. Thanks for the introduction, and thank you, APHA, for inviting me. So as Sue mentioned, I'm Monica Mitra. I'm at the Heller School for Social Policy at Brandeis. And the question is, where did I start? You know, where did I, my origins about mentoring. And it really started, I'd say, in high school. I was not the best student, and I had a couple of faculty, a couple of professors who really, really believed in me. And I felt like that instilling of confidence helped me to really become who I am today. And I think that's something that sort of continuously has followed me and it's something that I take very seriously even today, is building confidence in the people that I mentor.
Great. Max, how about you next?
Sure. Thank you very much for the invitation. I started mentoring more formally with the National Highway Traffic Safety Administration when I worked in a Seattle regional office for NHTSA and hosted a number of public health fellows through the ASPPH program in fellows out in Seattle. And working with those three mentees really got me involved in the formal mentor program. And currently I actually am the contract officer representative over the ASPPH program with National Highway Traffic Safety Administration, where we currently have 6 fellows.
Great. Lavon, please.
Thank you, Sue, and thank you to APHA for giving us this opportunity to share our experiences and impart some of our lessons learned to the next generation of the workforce. In terms of where I got my start in mentoring, I think similar to Monica, it really started when I was pretty young. My parents were actually ministers. They were pastors of the church, and they instilled in us the importance of sort of giving back to our communities, to the next generation. So one of the requirements that myself and my siblings had to do was to serve as a mentor to the younger children, not only in the church, but also in the broader community. And so we were very engaged in community outreach and sponsoring summer programs for at-risk youth and that sort of thing. So I really got that as the foundational virtue at a young age. And as I progressed in my education and my career, I was both the mentee and the mentor, at different periods of time. And in every single case, I found it to be beneficial. Even as a mentor serving, to share my experiences with my mentees, I've also benefited. I appreciate the fact that we're talking about this today and really bringing the importance of mentoring to life.
Perfect. And Emily, if you would tell us about you.
Yeah, of course. And thank you again. I'm just going to echo everyone else's sentiments for APHA for inviting us. And also, I'm very excited to be with all of these fabulous panelists today. Mentoring has really shaped a lot of my professional trajectory. I really sort of became involved in mentoring sort of unofficially at first when I first started in public health and when I was an MPH student at the University of New England, and I became involved with the Maine Public Health Association and really got to sort of gain organic mentors through just being involved with the state affiliate that I lived in. And then that kind of sprouted to a lot of opportunities and even job opportunities. And since then, I've been very involved, as Sue mentioned, with the Student Assembly and their approach and involvement in mentoring. And at the Atlanta annual meeting a number of years ago now, I attended the Student Assembly's speed mentoring session where I met another one of my mentors who actually, two of my mentors were two out of the three individuals who actually gave me letters of reference to the current job position that I hold as well. So mentoring has definitely been very interwoven in my professional career and trajectory.
Great, thank you, everybody. We're going to turn to benefits and challenges now. This includes what each of you sees as the benefits of the mentor-mentee relationship. Also, any challenges that you would like to identify, especially those that have come up in the past year or going forward. And we're asking each panelist to give one example of a benefit and one example of a challenge in their response. So Lavon, I'd like to start with you, please.
So in terms of a benefit, I would just echo what I said previously, that there really is a sense of self-fulfillment when you're able to help someone sort of reach the pinnacle of their career or their ability to self-actualize and actually progress, in their personal and their professional growth. And that's a significant benefit.
I think we're having some bandwidth issues. Lavon, maybe we lost your audio and video. I'm going to move on to Emily now, and then we'll let Lavon go back if she's able to resolve that. Emily?
Yeah, of course. I think benefits, so I talked sort of briefly in my intro of like the professional benefits that I've had of having letters of reference from previous mentors. But I think that the benefit also of being involved in a mentor-mentee relationship is just the relationship that you get to build and the community growth that you also get to sort of like take part in as well. The sort of saying it takes a village, right? Like it's really great to sort of have that connection and have that growth because I've had mentors and I've also had like mentees who are in slightly different areas of interest as well. But it's really great, sort of as Lavon was saying, to see people sprout from that and sort of be involved in that relationship as well and just be another support in their network. As far as a challenge goes this past year, I think the challenge has just been how, especially in the health field and public health field, how overwhelmed everyone has been, whether it's like virtual online school and work and responding for a lot of those who are on the front line of the COVID-19 pandemic as well. I know it's been very difficult to sometimes just get that gumption to send that email at times. And I think just sort of realizing that we're all spread a little thin right now, but treating, again, that relationship, going back to the benefit of treating that relationship as an extra supportive resource. It shouldn't be a burden. It should be a relationship that's beneficial for all.
Very nice, thank you. And Monica, how about you?
Sure. I'd like to just add to what Emily said. I mean, it's that community that you build. And through this, and it's a global community, really. But in terms of also the benefit, definitely there's a sense, fulfillment, you feel so proud, but it's lifelong. And I think that that's what we have to remember. These relationships, formal or informal, you might not be in touch with them, but you might read about them. You might read a paper that they've written. So it's not something that ends after the person graduates or leaves, sort of, you're no longer part of the formal relationship. And in terms of a challenge, I'd say in the last year, I think the piece that Emily mentioned, definitely the mental health piece, we're all spread too thin. But the piece that I miss most is the casual interaction. Whether it's going to APHA and meeting someone in the hallway that you used to have a relationship with, or actually just in the hallway of your workplace. So I think that the casual interactions and the hallway interactions is what I miss deeply.
Very nice, thank you. And Max, your benefits and challenges, please.
Yeah, I think from a benefits perspective, for myself, I get to understand and learn new public health practices and perspectives from the mentees themselves. On their end, from a federal employee standpoint, it's not easy to get a federal employment job or internship. So these types of mentor-mentee relationships allow the mentees to try federal employment and federal assistance, which is a great opportunity. And coupled with that, following on Monica's discussion, one of the challenges is, as she mentioned, really engaging more personally with connections or staff. And as our agency, NHTSA, has jumped on board to use of virtual meetings, making them less formal engagements is a real challenge. And so after a few months of the pandemic, I think I got into a habit of cold calling people by video and dragging my mentees into those discussions, even if they're not comfortable doing it, to make sure that they don't see it always as a formal engagement, but to try to grease the skids of those informal and casual discussions. That's a challenge.
That's great. You all have given me a lot of different, I'm looking down, writing important notes, because these are some really great highlights of also opportunities for moving forward. Hopefully Lavon can get back on and join us again. We'll move into the second section now, which is the mentoring relationship and process. So this is going to be divided into two sections. First, building the mentor-mentee relationship, and the second is best practices and resources. So let's start the first topic. How you build the mentor relationship includes starting mentoring conversations, closing them, and or keeping on in an ongoing way. And two of you have already referred to, lifelong, ongoing relationships. You see them, you hear them. But also, if you could also describe how it works for you in terms of your mentoring practice with mentees. What does the process look like? How often do you meet? What content do you try, not necessarily what content do you try to cover, but what do you discuss regularly? Are there topics or ways that you check in to move forward? So Max, I'd like you to start with this one, if you don't mind. We have a little bit longer for each person to give us really their thoughts and their experience on starting on the process itself of conducting it, but also how it looks for you and what you particularly bring to it.
Sure, I'd be happy. Let me start talking a little bit about how I work with starting the mentor conversations and relationships in our agency. to be frank, I don't have a specific formula. I don't have a specific practice, but what I think first I do is set up routine meetings with the mentees on a routine basis. I would say weekly meetings are my common practice in working with mentees that I have assisted with, and making those personal video calls, informal, not necessarily structured, but more general discussions to try to understand their interests and concerns and questions and draw other people within our agency that can perhaps answer and help with facilitation of their interests or their research ideas. That's really, in a nutshell, how I begin those conversations. Our program, in at least in NHTSA's frame, is a relatively informal, unstructured program, which allows the mentees the opportunity to really pursue their own interests in an unstructured fashion. And to be honest, sometimes that can be a little unnerving and a little disorienting for some mentees with lack of structure. So helping them to craft some of their own structure is also part of the initial discussions that we have.
And how about looking at closing the relationship, or the way you are able to bring it to at least that step closing, even if it's ongoing? Do you have anything specific you'd like to add on that?
Nothing formal. From a programmatic perspective, we typically have checkout interviews or sort of closing interviews with participants. But I think, as Monica mentioned, I don't really think of the closing of these relationships, because these are really introductions in a formal capacity or formal relationship, but really the beginning of a longer term relationship, even outside of a formal program. So I typically don't think of an end of the relationship.
Perfect, thank you. Emily, how about you next, please?
Yeah, I'm trying to think. So it's been, I think, interesting, my sort of introduction to mentoring and that sort of relationship, because I've had more formal introductions, like for example, at the speed mentoring session that the Student Assembly hosts every year at the annual meeting. Like I mentioned when I met one of my mentors there. So speed mentoring, we set it up just to give everyone a sort of background of what it looks like. It's like a speed dating where you meet a lot of mentors for like 10 minutes at a time, and that's just what it is for a couple of hours. And one of the mentors I met at the time was Betty Daniels, who just finished her term on the executive board of APHA, and she's been a registered nurse for a very long time. And at that time, I wasn't enrolled in nursing school yet, and but I told her that was sort of my trajectory and like what I wanted to do. And the next morning, she had invited me to the public health nursing section meeting at the annual meeting. So I think, as far as building that relationship, just sort of being open-minded of how it will go and how it will form and everything like that as well, and taking those opportunities to sort of say yes. And like Max talked about, maybe it's not fully always comfortable for the mentees, but I think that's okay. It's okay to sort of venture into these new territories, because that's something that you want from the mentor-mentee relationship as well. And conversely, I think when I've been sort of gotten involved with mentoring in more informal mentoring programs, but have created a mentor-mentee relationship, is just through asking questions and wanting to sort of get involved and not being afraid to sort of ask questions. And I can speak about just my experience with the affiliates in the American Public Health Association overall, is that a lot of people want to share their knowledge and want to share opportunities. And I've just met so many individuals who also, if they don't know the correct answer or correct direction to point you in, they know someone else who does. So I think just being ready to sort of ask questions and sort of dive in, I think is a really great start, a great place to start.
Great, perfect, thank you. Monica, love to hear
Sure.
from you.
Sure. So I think in terms of, there's two kinds of mentoring that I engage with, the formal and the informal. So let me just talk about the formal piece of it. Is, we have a postdoc program. And so when a postdoc, when I start working with the postdoctoral fellow, I actually have them do an individualized development plan. I want to understand what their larger goals are. in terms of their career, their professional trajectory, but also in the next year, what do they want to achieve? And then that's a conversation starter. So it's not a static document, it's a dynamic document that changes like during that particular meeting, but it changes over the year or the years of our relationship. So I think and in an informal setting, that's in an informal mentor-mentee relationship that just happens organically. And in terms of your question about closing, this is something that one of the most important mentors in my life during my PhD is, her door was always open. Her door, and that is something that I very strongly believe in. Even if someone who I have mentored as their PhD advisor and chair of their committee, when they leave, they know that they can text me, and they do. And I think that it's going back to Emily's, it's this community that we build, and I'm not willing to let go. So they will always be part of my life in some way.
Thank you. I love that. It reminds me of that's how I feel. I feel too. It's great. Okay, so let's, again, we're missing Lavon. I know she would have so much to add to this. But let's go on to best practices and resources. And if each of you could give us one or two examples of a mentoring best practice that you feel is really important, really underscores the way you move forward, that would be great. And any resources online, specific people to follow on LinkedIn or Twitter or where else you're on social media that you find particularly helpful. I know that these actionable pieces will really help everybody. And Emily won't be surprised that I'm starting with her because she had some great ideas as we were talking this through.
Yeah, so especially for anyone who's involved as a APHA member, or even not, if this could be a really great way to get involved, the Student Assembly has put together a number of mentoring resources. And we have, I oversee our mentoring committee right now. And just the other day, we had a student reach out who had a specific question about like a research area in nursing. And we were able to sort of point them in the right direction. But we also have a number of resources, some that are provided by Sue on this call, that are really great resources. Mentoring.org is another really great resource for students as well. And they have what they call National Mentoring Month, which happens every January. And as Sue mentioned, if you're not involved, if you're not on Twitter yet, I highly recommend a professional Twitter. I specifically got a professional Twitter myself because of like APHA, and public health Twitter is very, very active. You're sure to find someone who has a similar area of interest. And it's a great way to keep that community feeling as well.
Great, that's terrific. Thank you. Monica, how about you?
Sure. So in terms of sort of formal resources, I think I can just tell you something that I believe, because I know there's a lot of participants who are interested in mentoring, right? And so I think that this is our responsibility. It should be part of our DNA as a researcher, as a practitioner, as in whatever capacity, whether as a teacher. And so it's our responsibility beyond the materials we leave behind, whether it's our papers and all the work that we leave behind. This is another really, really important part of our legacy. So so it's something also I take very seriously. But in terms of formal resources, what I've done with the formal mentoring programs is taken, for example, resources from NIH. And then I adapted to our institute and to our needs. So it's not something that we take off the shelf, that we always have to adapt it. And I think that that's also, there's another level of adaptation, is people are different. And you go to where your mentee is, right? So we start with a plan, and COVID happens, things happen, people react to things differently. And so the plan always changes and adapts and throughout the course of the relationship. But Emily, I will surely check out your the resources that you mentioned.
Great. Max, how about you?
Sure. You know, one of the things that I have taken it upon myself in our agency, the mentees that I work with in a formal capacity typically last 1 to 3 years with this Association of Schools and Programs of Public Health program, the ASPPH program that we help. And while others in my office think it's a little silly for me to send job opportunities to the attention of the mentees that I work with outside of my agency, I would beg to differ and suggest that one of the practices that I like, and I think the mentees appreciate, is understanding where they're heading in their trajectory for job opportunities. And so I usually ask them a good amount of details about what positions that they're interested in and types of job functions they're interested in. And then as I see those opportunities, I make sure to both forward those opportunities to them, even if it's totally disconnected from our agency, but also if I know of individuals in those agencies that might have job opportunities, how I can connect them with them. So that's a common practice that I use to try to make sure to help connect the mentees to job opportunities and individuals that may be able to shed light on those job opportunities for the mentees. That's one practice I do, but also, as I mentioned before, another best practice is I try to, in this unusual pandemic era, to make sure I'm on video and informally talking with the mentees on a routine basis, because I do think, unfortunately, a lot of tendencies for people is to not show their face on these types of interactions by, these sort of virtual technologies, but making sure to have a face-to-face discussion. That's another practice I try to preach mostly on a daily basis, even if I would rather not get out of my pajamas.
I was going
Sue,
to weigh in
can I
really
just-
quickly, Sue. We do have Dr. Ortega back with us, so she joined on phone. So unfortunately, I can't spotlight her, but I am going to unmute her. So
Okay.
Dr. Ortega,
right.
you are back with us.
Perfect. Let me have Dr. Ortega. Levon, welcome back. Let me have Levon answer, and then Monica, I know you had another comment. We have time. Levon, we're on the section about best practices and resources for mentoring, and I wonder if you could share with us a couple examples of each of those that you feel work well for you and what you're doing.
Yes. Are you able to hear me?
Yes, it's great.
Okay. My apologies. My work computer just crashed, and spent the past few minutes trying to get it back up, but I'll have to sort of do.
You're here now. We're glad to have you back.
Yeah. So in terms of best practices for mentoring, I would say, as a mentee, I think, being able to be prepared to drive the mentoring relationship. So, think about what you want to get out of the relationship. Think about your career path. Work on establishing those SMART goals, and think about how this particular mentor, you think that they can help you sort of achieve or accomplish those goals. And, just go into the discussion being prepared to share that information. And, be proactive, be the one to offer to schedule follow-up meetings. If you don't hear from them, oftentimes, depending on the level your mentor sits within the organization, oftentimes they're very busy. And so if you don't hear from them as often as you'd like, you be the one to reach out and say hello and say, I would love to schedule some time to talk with you. Ideally, it would be good to schedule sort of recurring meetings, ideally, especially if you're engaged in the mentee-mentor relationship for, a period of time, whether it's a year or 2 years. Establish that from the beginning so that, that time within their calendar is secure. And then when I sort of fell off, I was sharing, I started to share a little bit about an article that I read in the Harvard Business Review, What the Best Mentors Do. And, they had some really good suggestions. And so this particular feedback is specific for mentors, but the mentees can learn from it too. And the author basically says, number one, to put the relationship before the mentorship, that there should be a baseline chemistry between the mentee and the mentor, and there should be a genuine intercollegial relationship between them. So, choose appropriately. Not everyone would be the best mentor for you at a particular stage in your life, and vice versa. Number 2 is to focus on character rather than competency, that we should seek to shape the mentee's character, values, and capacity for respect. Good leaders know value-based qualities matter more than skill enhancement. Number 3, shout loudly with your optimism and keep quiet with your cynicism. And I think that speaks for itself. And then finally, number 4, be more loyal to your mentee than you are to your company. And this might seem a bit controversial, but I think what the author has to say he really hit the nail on the head. He says, we want people to be effective in our organizations. That said, the best mentors recognize that leadership is a duty and service towards others. And that is the best way, and the best way to inspire commitment to the organization is to be fully and selflessly committed to the best interests of colleagues and employees. Don't seek only to uncover your mentee's strengths, but look for their underlying passions also, and help them find their calling. And I thought that there was so much richness in that advice. So.
Oh, I absolutely love that. And I can see the others smiling here. So I know that resonated for a lot of us. And thank you for the reminder about that article. I have one more question that the panelists don't know I'm going to ask, but because we have a little bit more time, I'm always curious and I ask mentees this. So I'm going to ask each of you, what was something a mentee told you that was so meaningful to them that surprised you about your relationship with them? Because for me, it's usually, anyway, let me start with Levon. Let's get you back on, make sure you're able to tell us what's one thing that you really treasure, value, found surprising that meant so much to someone.
Yeah, so I think one thing that was surprising and really meaningful to me. So when I finished college, I actually taught 3rd grade for 2 years before going back to school. And one of the students that I taught, and I didn't really remember the student, but she told me, I happened to meet her. I actually met her at a meeting, and she was on the career path to become a doctor, because she knew that that was something that I had told them basically when I was leaving, why I was leaving, and that sort of thing. And she just shared with me just how much my sort of example. And I didn't necessarily formally mentor her outside of the classroom, apart from just being a teacher and just doing my job. But she said that I had such a significant impact on her. And I think the lesson that I took away from that is that, don't underestimate the power of informal mentorship too. Even in going about our everyday lives and doing the things that we have purpose to do in life, that there are people watching, and that there are others who look up to us, right? When sort of the next generation that's looking up to us. And so, just the importance of keeping that in mind and sort of, responding accordingly.
Great, thank you. Max, how about you?
I'll have to pass the buck because I'm struggling to find an answer to your question. So I'll think on that a little bit.
All right, Monica?
Sure. I'd say my most recent encounter, I mentored a doctoral student who graduated last August and moved to a postdoctoral program in a different city, and then reached out to me about a month ago and said, can we have a conversation? And then as we got on our Zoom videos, I think the first thing he told me, he says, I didn't realize how much this relationship meant to me until it was no longer part of my life. And I was, I'm just, getting goosebumps. It obviously meant a lot to me to hear that. So
Yes,
it was
great,
wonderful.
great.
And I just want to also second something that Lavon mentioned about keeping it personal. And I think especially now, I always begin my calls and my communication with, how are you doing? And sometimes that's all we stay with, because there's a lot going on in people's lives. And sometimes that's what you need to pay attention to.
That's great. Thank you. Thank you for that. Emily, how about you?
Yeah, I'll share an experience both as a mentee myself and as a mentor as well. As a mentee, I think, sort of honestly echoing Monica's story, I think just having such an ongoing relationship with my previous mentors, who we've had a mentor-mentee relationship, but also it's just grown so much beyond that as well. And I think just having that sort of relationship, and I feel like they've had so much trust and belief in the work that I can put out and do. And that's just meant beyond the world to me. And I feel like a number of opportunities I have either gone after or I felt confident in because of that relationship as well. So it's just a great relationship to have. And then personally, myself as a mentor, I'm also a graduate mentor for nursing students at Columbia as well. And recently, it's kind of been a very full circle moment for me, because they asked if I could be a reference for them as they're pursuing an employment opportunity as well. And of course, I was very excited to sort of have that and be their vocal supporter there as well. And it's just kind of been a very nice full circle moment to have come back around.
Great. And I realized halfway through that, Monica, I had skipped over you. There was something you wanted to add as we were winding up best practices and resources. So I don't want to forget to let you comment.
Sure. There were two things I wanted to mention. One was the personal piece, which I did. And the other piece is that I think when you're mentoring someone, I believe in the cascading approach. So part of the doctoral program that we've started at the Lurie Institute is that where the postdoc program is, the postdocs also mentor undergraduates who are interested in disability research. So, you also instill in the people that you're mentoring the importance of mentoring and the countless benefits of mentoring.
Great. This has been really a rich discussion. I have notes all over about things I'd love to summarize, but I want to turn to some interesting questions we're getting from people submitting them. So I'm going to start with this first one. Do you have any suggestions or thoughts regarding mentorship with the opposite gender, or is it better to mentor the same gender? Why doesn't whoever wants to start with this question? I'm not going to call on any of you who would like to start answering that.
I'd be happy to start this discussion.
Yay.
As a male in public health, I oftentimes find that I'm sort of outnumbered in terms of female to male ratios. As a formal mentor, I have not actually had same-sex mentees. I've only had opposite-sex mentees. I don't know that I've received constructive criticism or positive encouragement either way. I don't think that there's any difference, at least in my mind. I would be curious from some of the mentees I've worked with if they would think differently, but I haven't actually queried them on that. So that would be interesting. But I personally don't think that there's any difference, but I'd be interested in hearing other people's perspectives about that.
Okay. Any other panelists have anything you want to add, Monica?
Sure. I think I mentor all genders, and I think what I think is the most important piece is what Lavon mentioned, is the chemistry. So that's, and establishing the chemistry. The chemistry doesn't mean as you enter the room, you find oh my God, here's the perfect mentor, but it's something that you can establish. And that's through these personal conversations.
Great. Anyone else? Okay, then our next question is, as mentors, do you have a preference in how potential mentees approach you? Or could you offer best practices for those who are seeking mentors? So who would like to start?
I can start that one.
Great.
So I have a kind of few different prongs of advice to it because I think it depends sort of if you're looking for a mentor within your program or school or something like that versus elsewhere in the professional field as well. If you are a member of APHA, I'll put my email later in the chat, and please feel free to reach out to me after. But within APHA, I think that there's a number of different ways to do it through either like affiliate membership or your sections that you're involved in, or a number of things like that. So there's the first hurdle of like, who do you contact and who are you trying to find? But I think when you have that contact information of how to go out about it, I think just sending sort of like an inquiry email from like my past experience as well. And for the most part too, and I'm sure I'll be interesting to hear from others on this panel, but I think especially those who introduce themselves to you or like are part of some sort of mentoring program, they're open to receiving contact. And that's sort of something that they give by just being in a mentoring program or as well. So they're expecting to sort of have that conversation and that inquiry. And I think just sort of an introduction and then like maybe a couple of questions as well, because if you just want to establish a mentor-mentee relationship, it's not going to get too far off the ground unless there's some sort of like communication base. Like what is it? And I think Lavon said this as well, is like, what is it that you're looking out to get out of this relationship? What are some specific questions you have? Are they sort of research related, or like, where is it that you want to go with this relationship? Because that's, I think, some important information to start establishing the relationship as well.
Great. Panelists, anybody else have a burning desire to answer this, or we'll move on? We have plenty of questions coming in, so either way is fine. All right, well, let's go to the next one, because this actually leads into something that one of you brought up during the formal part of our presentation. Regarding personality and chemistry, if there is no compatibility, can you refer a mentee to a mentor you feel would be more compatible? Who would like to answer that? Anybody? What do you do if from your side you don't see that? Monica, I saw you on mute, so I assume you want to respond. That's great.
Well, I can try. I mean, this is, you know, it's a delicate balance, right? I think it's not what you say, it's how you say it. So I think that if, you know, I have referred someone to someone else, not because I felt about the chemistry, but it was about the subject matter, you know, what they were pursuing for their doctoral program, right? So, but I think it's so absolutely, if you feel like there, for some reason that it would be a better relationship and it would be better for the mentee, then, you know, I think find a way to very gently guide the mentee to this other person.
Great, perfect. I have the next question is a great one, and I hope that all the panelists that feel comfortable can answer this, because it's a question that I think about in the programs I'm in. One barrier we faced is that minority first-gen students are worried, scared, shy to request support. How can we encourage more minority students to participate in mentoring programs? So who would like to respond?
I can respond. Our program with the Association of Schools and Programs in Public Health have actually in their mission statement and platforms regarding support for minority and other populations. So they actually have some institutional written policies to try to encourage that. So I think the programs that we have supported, for example, have specific interest in that and try to encourage information dissemination to entities and organizations that certainly shine a spotlight on minority populations. I think in practical purposes, I don't know of any specific policies or practices that we use on a routine basis, unfortunately, in our program because it's quite small. But I think, practically speaking, just ensuring that we're trying to make as many connections with people and others that we know in realms of where the mentee's interests lie is probably the best bet. And I think just following on some of the discussion that Monica mentioned, I don't know how to gauge relationship compatibilities, but I think offering additional connections to additional individuals allows those individual mentees to search out people that they feel more comfortable with and have a better connection with.
Anyone else?
Yeah, and this,
Go ahead.
yes, if I could just tag on to what Max said.
Perfect.
At CDC, we have a number of fellowships as well, several of which actually are focused on recruiting racial and ethnic minority groups and other underserved students. Those fellowships are managed out of the Office of Minority Health and Health Equity. Some may be familiar with like Project Program Imhotep as one of the fellowships. But even within the fellowships that we manage that are open to all, I mean, there has been, I think, renewed interest in really making sure that we're looking critically at how we do our recruitment and our recruitment efforts, and also even just advertising, marketing. Where are our announcements going? Are we reaching a diverse audience or a diverse pool of potential applicants? And so we're also making a lot of effort at CDC to make sure that we're reaching those students as well.
Great. I'm glad you jumped in. I was going to call on you anyway. Monica or Emily, do you have any thoughts on that? Both of you interact directly with students that would be affected by this that may not have had a mentoring relationship before. Monica, did you want to start?
Sure. And I think, I go back to what I said before. As a community, it is our responsibility. It is, and especially our responsibility to mentor the next generation of researchers and of practitioners who come from, who are diverse and come from marginalized backgrounds. Having said that, I think, from the mentee perspective, going back to, you're shy, you're nervous, how do you start that? I think there's two ways. One is trying to apply to formally to all different programs, right? And then the second is how do you try to talk to someone and communicate with someone who might not know you, right? But you think this person would be a fabulous mentor. And I think the best way is to send an email asking some kind of a question related to a topic of mutual interest and seeking to schedule a meeting. So you're not seeking to build a mentoring relationship. And I think this goes for everybody. You start off in the informal mentoring with just, can I talk to you? I'm interested in this, and this is who I am. And then, and then slowly build a relationship. And it's not easy. I have no doubt, but I think to me, if you don't ask, you will never know the answer. So just putting yourself out there just a little bit.
Great. Emily, any thoughts?
Yeah. I think that this is a really great question. And I think sort of echoing a lot of what Monica just said there as well. I think from like the student perspective, I think it's a little bit of, it's vulnerability to put yourself out there and ask those questions. But I think it's important to keep in mind as mentors of like meeting the student where they are at, because this is sort of an uncomfortable question for them of what they're like coming to you from. So I think, but as I sort of said earlier, a lot of those who are sort of involved in mentoring are expecting this as well. But I think just like it's important to keep in mind the sort of background that students can be coming to you with. And I'll say as well, as far as those who are interested in building mentoring programs, to make sure that you're recruiting mentors who are of diverse backgrounds themselves. I think having a sort of reflective pool of mentors is a really great way to bring students in as well.
Great. I really appreciate that. And it reminds me of Max saying that what he misses, sorry, I don't remember who said it. You miss the casual interactions, not just APHA, but walking down the hall. And those definitely were areas where I felt we were able to bridge more of those. But I thank the person who submitted that question for allowing us to talk about it. It just reminds all of us that we need to remember that that people don't have experience asking for mentors, and Monica referred to that. So, all right, another great question. Any advice or experience with a mentee who is especially quiet and reserved? It's been difficult to build a relationship. Who would like to take this one on?
That is a tough one. I would say as a mentor, think of the long game. And while it may be difficult to pull some people out of the shell that they may have, what you can do to introduce and encourage brief interactions, I think is beneficial. And I'll leave one idea of use of pandemic methodologies with these types of virtual connections. I think of even setting up a 10 to 15 minute conversation between the mentee and another individual. Most people wouldn't have hesitancies talking with somebody for 5 or 10 minutes. You know, scheduling a half an hour meeting with somebody, that's a lot of time. But, you know, frankly, just a 10, 15 minute quick meeting, I don't think most people would have hesitancy doing that. So I encourage people to try to do that more by video.
Okay, other comments or suggestions? How to
And
build
that's
a-
something I love your Max, your, keeping it short, but I think the other is having the mentee come to a meeting with their questions, like they're going to, and or tell them that they're going to lead the meeting, and maybe just address it, after you've built this relationship that, you're not calling them out, because that's, of course not what you want to do. But again, you want to encourage them professionally to go beyond themselves, right? So, why don't you drive the next meeting? You ask the questions and we'll go from there.
Great, great. Emily or Lavon, do you have anything to add to how to build it with a quiet, reserved mentee?
Yeah, those were both great suggestions. Another suggestion that folks might find useful, I did this. Actually, typically what we do is I would take my fellows to lunch, and we would just chat informally. And it's interesting how folks that are usually very reserved, how you see them just in a social setting, just sort of come out of their shell with you and with their peers and that sort of thing. And with the pandemic last year, what I did was I sent them gift cards for lunch, and we did lunch over Zoom, and that was part of their kind of celebratory. That was for those who were finishing their programs, and so it was part of the celebratory aspect, of completing the program. But I was thinking about it the other day, and I said, you know what, I can incorporate that during the year too, if we're still sort of working remotely come during the fall. So I think just finding ways, because sometimes when you're sitting in an office behind the desk and the mentee is on the other side, sometimes it feels like there's a power differential sometimes, and sometimes some folks get really choked up with that. So changing the setting sometimes, I find that to be helpful as well.
That's great. All right, I'm turning to another question. What do you think about interprofessional mentorship versus same profession mentorship? I can see the benefits of both, but would like to hear the panelists' thoughts.
I can jump in for this one because as someone who started in public health with my public health degree and is now pursuing more the clinical practitioner aspect of things, I've had mentors who are from both sort of research fields. I've had more like the public health advocacy side, and I've also had those who are more on the practitioner side as well. And I think both have been really great and beneficial to me. In both I've used for sort of different things and different areas to grow and everything like that. So I definitely see the benefit of both. I think that sometimes, and if you're able to sort of have an interprofessional like mentor-mentee relationship, I think it's really great because one thing in the last sort of like having I think Levon just said it, with having sort of like the power dynamic, one thing I think that's really important to keep in mind as well, that we've kind of been circling a lot around for this panel discussion, is how it's a bi-directional relationship between the mentor and the mentee. And it's something that both individuals get a lot out of. And I think that whether it is same profession or different, I think that they can both be really beneficial and really great to both parties involved.
Perfect, great. Okay, Rita sent I'm specifically naming her because she wants to hear from people. I'm trying to start a mentoring program as part of advocacy committee initiative of one of our organizations. We have student members as well as seasoned professionals. And since we have 2 minutes left, I wanted to ask if anybody had specific tips they want to offer Rita really quickly, any of our panelists, and then we'll close and turn to Holly to close us down. Anybody?
I can go quickly. I think it's great because you, first of all, you can have this cascading mentoring program that I was talking about. And then the other piece is peer mentors, right? So you have students, you have professionals, so you can have different types of mentoring ongoing where people can choose. Do you want a peer mentor? Do you want, a more seasoned professional? And you can structure the program based on the structure of your organization.
Anyone else have tips for Rita? All right, then I'm going to turn this to Holly to close our meeting. Thank you very much for the opportunity to work with a great panel. I really enjoyed it, and as always, learned so much from everyone else and from everybody's attendance and great questions. Holly, thank you.
Yes, thank you. A huge thank you to all of our panelists who joined us today. A thank you to Student Assembly for being our co-sponsor of this webinar. I love that you all dropped in your contact information for people who have additional questions. I know people had a lot of questions and probably still more even after hosting this webinar, but I hope it was helpful to all of you, especially with it being Student Day of National Public Health Week. Mentoring is so important to support our students. And just a quick reminder that National Public Health Week lasts all the way through Sunday. So if you want to see additional ways to get involved or other events that are going on, go to nphw.org. And thank you all again so much. Thank you to everyone watching. I hope you have a great rest of your day. Goodbye, everyone.
Bye, everyone. Thank you.
Thank you.